want to start off, guys, with the high yield video, okay? It's only 13 minutes long, and let's just start quickly because we don't have time to talk. Guys, pay attention
It's a
carefully.
protozoan parasite of the phylum Apicomplexa. It is distributed worldwide and can infect all warm-blooded vertebrates, where it develops as an obligatory intracellular parasite.
Any questions?
No, we're just kidding. There's no video.
There's no video, guys.
We made that up. All right. Everybody have a sheet? Are we good to go? All right. So let's get started.
Okay, so quickly intro. Basically, we made this course/review course, whatever you want to call it, in order to help you guys study and prepare you guys for the IRAT, CBL, quiz. So like these sheets should kind of be your foundation, just like histo, and then you guys got to study, right?
Right. So understand, the parasites as a whole is a low yield topic, but it does come up. On our last MBME, our last practice MBME, we had 3 questions come up in parasites. Okay. The good news is with parasites, for the most part, they ask you the questions very straightforward. Since it's so low yield, if you do get a question on it, it's going to be with the buzzwords. So we're going to try to teach you the basic concept of each important parasite, and then give you the buzzwords you need to know. Alright, it's important when you go home tonight and study for the CBL, know the buzzwords, know the symptoms of what each parasite causes, and know the drugs associated with each. Okay?
Okay. Also, just like in histology, you guys have keywords at the bottom of the sheet. Write that down, memorize it, because that's like ideal.
Alright, let's do it.
So, let's start off with just basics. So we have parasites, right? You can tell me what a parasite is.
Guys, it's Bio 101, you got
The
this.
parasites? Who took Bio 1? Good job, guys. So it's just an organism that lives off its host. So it needs to be inside our bodies, inside of animals' bodies to survive. Very basic. So the boards wants you to know 2 groups of parasites. Is this 2? Okay, they want you to know 2 groups of parasites. We have protozoa and worms. So what's the difference between these 2? Protozoa are unicellular organisms. For those who don't know, that means you're just one cell. Worms are multicellular.
So this is the thing, guys. Our course, me and Nati, are going to cover just the protozoa. Why? Because they're more high yield than the worms. Though you still have to know the worms, we feel that if we can teach you the protozoa and you can get the foundations of these higher yield protozoa, then it'll be easier to learn the worms. Okay? So this course is just going to focus on protozoa. Okay? The CBLs, unless we tell you otherwise, are going to be focused on what we teach in class. Okay? Cool. So now a couple of terms I want to go over just quickly. So now, you don't have to know the definitions of these terms. The terms are on the board. I'm going to write them on this board also. You don't have to necessarily know the definitions because you're not going to get tested on the definitions. But we kind of want to give you a taste, a feel for what these words mean. Because we know microbiology is a kind of new language as it is. So you're going to see these words in first aid. You're going to be saying these words in our classes. So cyst. What is cyst? So a protozoa can be in 2 forms. It can be in its cyst form, or it can be in its, it says trophozoite there, but I like to call it the zoite form. Because zoite is kind of the, what do you call this? What do you call the end of the word? A suffix that they use to describe the infective form of the protozoa. So the cysts usually you'll find outside of the body. When I say the body, I mean the human body. You usually find them there. And it's kind of like an egg, okay? So it's kind of like a cyst looks like. You can see that on stool samples. Stools outside the body, so you'll see it in stool samples. It's the parasite's way of protecting itself from the outer environment. Okay, so sometimes like you'll read, it'll say, this parasite's infected by eating the cysts out of fecal matter. Okay, because the cysts are outside the body, and the zoite form is inside the body, almost like when the cyst gets inside the body, the egg cracks open, and then the protozoa comes out to play. Okay? And in each one, we're going to specify to you which one's a cyst, what kind of zoites are in there, okay? But that's basically, when you hear cyst, think outside the body, think protecting itself, and when you hear like anything that ends in zoite, then think that it's infecting. It's going to become a lot clearer during the lecture, okay? One last thing, amoeba. I'm sure you've heard the word amoeba, but an amoeba is a single cellular organism that kind of it kind of swims on its own. But the thing about an amoeba is it doesn't have a cyst form. So even outside of the body, it's in this amoeboid swimming form. So an amoeba is the same form inside the body as it is outside the body. Those are just some basic terminology. Make sure we didn't forget anything. And let's get started. Any questions? Okay, good. Plasmodium. So now I really wanted to do this one because it's like the biggest parasite of all. It's the most infective parasite in all of the world. But Nati had different ideas. Nati, tell them more.
Guys, do you know why, with the raise of hands, why I chose this one? Anyone know? No? I actually wanted to keep John quiet for like 10-15 minutes, so this is going to be amazing. He's actually going to stay quiet while I speak, which doesn't happen often. Thank you guys. You guys can laugh a little more just to make me okay, so guys, just again, it's important for you guys to know cyst and zooid. Cyst, again, you want to live, it's a form, it's an egg, like John explained it, and it wants to live outside the body, because the body has favorable conditions, and the cyst, when the protozoa is outside the body, it's in an unfavorable condition. So it wants to protect itself and then survive, right? So I'm going to be talking about Plasmodium. How many people here have heard about malaria? Good. Plasmodium causes malaria. It's important for you guys to know the distinction. Plasmodium is a microbe. It's an actual protozoa that goes into your body. Malaria is the symptoms. Okay, so don't confuse the two. Malaria is the actual symptoms that you guys get. Okay? So we're going to start off with Plasmodium.
So now guys, just to start, Plasmodium doesn't have a cyst form because it never really lives outside of the body. The Plasmodium goes from the mosquito to the human. So actually, I know I'm not allowed to speak, you said, but can I just give them an overview? It's an overview, so they have an idea. Don't write anything down, just hear my story for a second, okay? So this is basically what goes on with Plasmodium, alright? So the mosquito has Plasmodium inside of it. It bites a human, okay? The Plasmodium swims through the mosquito into the blood of the human. First place Plasmodium goes is the liver. In the liver, it reproduces inside of hepatocytes, and when something reproduces inside of a hepatocyte, eventually it reproduces and causes the hepatocyte to burst, and then it bursts into the blood again, and then once it gets into the blood, it gets into the red blood cells, and again, reproduces
Guys, you
the
don't
red
need to
blood
write
cells.
this down. I'm going to be
You don't need to write
explaining.
this down. We're going to break it down step by step in a second. I just want you to have an idea of what's going on. It
Okay.
bursts the red blood cells, and then you get the symptoms. Nati's going to break it down step by step, very slowly. Go.
Okay guys, we're going to be teaching you guys the life cycle of Plasmodium. Very basic overview, because you actually need to know that for the boards. Okay? So basically what happens is this Anopheles mosquito, kind of looks like a bird, but you guys get the point. Mosquitoes have this like, it's how they infect. Okay? Anopheles mosquito kind of bites you. You guys all gotten mosquito bites. This is what happens. It usually happens in Africa. Okay? So it bites you.
Oh, key word, Africa. No, because you'll see, usually when you have malaria questions, usually a person went to Africa, returns from a trip from Africa. Malaria can happen in other places, but the boys like to talk about Africa. Okay? So one key word.
Okay, so it bites you, and it releases sporozoites into your blood. What does a spore sound like? A spore sounds like a seed, right? So it's releasing a seed, a spore that's kind of made it into like a sperm, because it's a seed, okay? And and what happens? A sperm meets its egg, right? So the seed, the sperm, the sporozoite, wants to meet the liver. That's the egg, okay? So I'm going to draw a liver here. And it's going to enter into the liver, okay? And when it enters into the liver, it becomes a trophozoite. So when a sporozoite enters into an organ, it changes its name. Why, you ask me? Because it changes its name to a trophozoite. Again, this is really important. Mosquito bites you, releases a sporozoite. The sporozoite swims, finds a liver. It changes its name into a trophozoite. The trophozoite becomes like a circle. Like, imagine a tail wrapping around itself. becomes a circle, and then it starts to multiply. This happens through a sexual reproduction.
Asexual.
Okay? Asexual.
Okay? The sexual reproduction, guys, important point, understand, the sexual reproduction occurs in the mosquito. Okay? Everything that's going on in a human being is asexual. Okay, know that difference.
Okay, so when it starts dividing through asexual reproduction, it forms merozoites.
So you notice the pattern, zooid, 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 because now it's in the infective form.
Okay? So guys, any questions? This is really important. Because I know this is like a bunch of words, but like the words don't mean, like, it shouldn't be complicated. Yeah. So the trophozoite forms or it enters, the sporozoite enters, becomes a trophozoite. It makes a ring. Okay, imagine the tail wrapping around itself. Then it starts to divide. When it starts to divide, and the trophozoite becomes 2, 3, 4, it's called a merozoite. So all it means is division of the trophozoite. They just changed their name into merozoites. Yeah.
Do you have to know how they divide? Like
Asexual reproduction. Yeah. Okay? Now, the merozoites keep dividing, and they form a sac around itself. Okay?
Yeah.
Okay? So the merozoites plus the bag, or the sac, it's called a schizon. Does everyone get that?
There you go. Exactly. Max. Exactly. Like a bag of shiz.
Exactly.
Bag of
That's
shiz.
actually what we're about to say. A bag of shiz. Okay? So again, a sporozoite enters. A sperm enters, finds its egg. The egg is the liver. Okay? It changes its name. Trophozoite. The trophozoite divides. When it starts dividing, it's called a merozoite. When it forms a sac around itself, a sac of shiz, we call it a merozoite.
No,
And-
shizon.
A schizon, sorry.
He calls it a merozoite, but I tell him not to.
Schizon. Everyone get that so far? Okay.
Are we good so far, guys?
Guys, it's important to know that this happens within one hepatocyte. Not throughout the whole liver. Within each cell, it infects and it divides. Okay? Yeah.
Like bad, like vacuole, or like what are we talking about?
It creates like a bag around itself. Like a
Cap.
capsule.
a shiz.
A shiz.
There you go. Great to see. That's it.
Okay, so what happens when you you guys ever go shopping in Israel and you're carrying back your bags of groceries and you put too much stuff in it because you're trying to be like efficient and it just bursts? That's exactly what happens here. Okay, imagine a shopping bag with a bunch of stuff in it and it's gonna burst, right? So when this bursts and it releases merozoites into the blood. Now, the Plasmodium is a creature that likes to be within tissues. It likes other tissues. So it's going to be in the blood and it feels lonely. Just like John feels sometimes when he's not without me. So,
It's true. It's true.
thanks guys, appreciate it. Okay? It's going to find red blood cells, right? Red blood cells are in your blood, so we call it blood. Everyone get that? Okay? So it enters, the merozoite enters, and remember, when something enters the tissue, it changes its name.
Wait, pop quiz. When the merozoite enters the red blood cells, what would you guys like to call it? If we said the merozoite enters the red blood cells. And that's what they call it too, a trophozoite. So it's a trophozoite
Anytime
again.
something enters, anytime a Plasmodium enters a tissue, it first starts off as a trophozoite. Okay? So the merozoite, which is in the blood, enters the red blood cells. Again, it becomes a trophozoite. And then it forms a ring. And these rings are important, because we'll show you why, because it's used to diagnose malaria. Okay? And then this ring, again, divides. What do we call the divisions when it starts dividing? Okay, but what is it called?
What's the new name?
Merozoites.
Merozoites again.
Guys, please, merozoites. Okay, again, what happens? It forms a bag. Okay? What do we say? The bag plus the merozoite? Schizon. Good.
So it's the same thing in two different tissues. So I know it's a new language, right? But you have the same words in two different tissues. The only difference is sporozoite is where you start. Okay? Sporozoite is where you start, then you kind of repeat it in both organs.
Okay, and this all happens through sexual reproduction. In this mosquito, sexual reproduction.
Got a question?
Sorry. The trophozoa you said are used to diagnose.
We're going to get into how that in a second, okay?
Sure, no problem.
Okay, just know the life cycle for right now. Okay. Again, what happens when you have a big shopping bag and you're carrying a bunch of groceries? It breaks. Good. So what happens again is merozoites burst red blood cells and release, and then you release merozoites into the blood. So guys, this is important. When it's inside the red blood cell, it's called the erythrocytic stage. Okay?
That means it's important.
This is called the erythrocytic stage. Why is it called the erythrocytic stage? Because another name for red blood cells is erythrocytes. Okay? So when it's in the red blood cell, it's called the erythrocytic stage. When it bursts out of the red blood cell, crazy story, it's called exoerythrocytic stage. Because it's out of the red blood cell.
And guys, let's say I just wanted to come up with a name, just out of nowhere. For what stage is called when it's in the liver? What would I call it? Hepatic stage, liver stage, there you go. So this is the liver stage or the hepatic stage, okay?
Okay, before I move on, any questions? Yes.
When the schizon bursts, do you call the things merozoite?
Yes. When they burst and it releases into the blood, it's called merozoites. It only changes its name when it enters another tissue. Okay?
And the ring form is the trophozoite?
Yes. So it goes inside, changes its name, and then becomes a ring. Okay. Now guys, this stage is really important because this is actually what causes your symptoms. When you're bursting red blood cells, that's really bad. Okay? So you get symptoms, which I'll explain. You're going to get cyclic fevers. Cyclic is important. Okay? And I'll explain that soon. You're going to get hemolytic anemia. You're going to get hepatosplenomegaly. Okay, so what does this all mean? Cyclic fevers, I'll get back to, but basically, fevers, why do you get a fever? For those who don't know, is when a microbe or something in your blood shouldn't be there, when a bacteria infects, when a virus infects, or when a protozoa infects you, in your blood, your immune system is triggered. And part of your immune system being triggered is it creates a fever. Why? Because we want to increase the temperature in your body to kill off the microbe. Right? They don't want to be in really hot temperatures. So that's why you guys get the fevers. Now, hemolytic anemia. What does lysis mean? Good. What does he mean? Blood. Anemia means decrease of red blood cells. So what's happening here? You get lysis of the red blood cell, which causes hemolytic anemia. So you're getting decreased amount of red blood cells because the actual bag that's here is bursting the red blood cells. Okay? Now, what's hepatic? Good. Spleen? Good. Megaly? Big. So you guys get a big liver and a big spleen. Why is it a big liver and a big spleen? Well, it's a big liver because you have the schizon, the bag of shiz, and this stuff that's replicating in the liver. It also causes destruction, yada yada yada, but it causes a big liver. Now, John will get into why the spleen gets bigger, but basically what happens is your red blood cells are infected with something. And what filters out your blood? Good. So if your blood is going to the spleen and it's getting filtered, and the spleen is realizing, hey, our red blood cells aren't normal. There's something in them. So they're going to start destroying the red blood cells. It's going to create an immune reaction. Your macrophages are going to come and start eating up and breaking down the red blood cells. So your spleen is going to get bigger, right? It's creating a reaction. You have a reaction inside your spleen. Okay. Did I miss anything?
Why cyclic?
Oh, I'll get to that. Okay. Anyways, cyclic fever means that I'll get to that in a minute, but the fever is not a prolonged fever. You know when you get a flu, you have a fever for like a few days? These fevers are interesting. You get fevers every 48 hours, every 72 hours, and then you get irregular fevers. So I'll get to that in a moment. So we're going to leave this up here and move on to there. Okay, so I'm gonna make a chart. This is actually thanks to Dr. Osharov who actually helped us put this together. Okay, so we're gonna say fevers. You guys actually have this chart. We're gonna say blood smear, which is
the glass. Yeah, and tight.
huh?
Keep it
Oh, tight. And then we're gonna have treatment. Okay. So the first type we're gonna talk about is PV-Vax. And P is for Plasmodium, PV-Vax, and Ovale.
Okay.
Okay?
The same group because they have the same
Symptoms.
characteristics.
Okay? This is nice. John's not talking, everyone's listening.
My voice.
Okay, so these fevers, again, cyclic, happens every 48 hours. If you guys don't know, that's 2 days.
Guys, 48 hours. If you see in the question, someone goes to Africa and they're having fevers every 48 hours, every 2 days, boom, PV-Vax Oval, no ifs, no buts. Alright, that's how pathognomonic this is, and that's how they ask the question. So you have to associate malarial type with fever length. You have
Again, this is just a type of Plasmodium that infects you. It's not complicated. PV-Vax and P. ovale. Okay? P. malariae is another form of Plasmodium.
Not malaria, malaria. So there's an E at the end. You spell malaria and then add an E. Malaria.
Okay? I'm pretty sure I'm right.
It's AE.
No, AE. So take the I out, put an A,
Okay.
subtract an I, add an A and an E.
These happen, you get fevers every
Guys,
7...
Google it after you spell it, but just pay attention.
This happens every 72 hours, every 3 days. Okay? And P. falciparum.
Oh, that's a bad man.
I want you guys to write underneath, bad dude. I'll get back to why it's a bad dude. And also, P. falciparum, false, it gives you false hope. Falciparum for false hope. Okay? And I'll get back to that in a minute. These fevers are irregular. So what does irregular mean? It means that you can have fevers every 2 days, every 3 days. It's not a constant cycle of fevers. Okay? Now, the way you diagnose this is you do a blood smear. Why? Because it enters your red blood cells, right? So it makes sense to do a blood smear. So,
You guys know from histo what a blood smear is? Trying to make sure we're all getting.
John's getting bored. Alright. Anyway, so PV-Vax and Ovale, the way you diagnose it is you see Schuffner granules. So all this means is that you have your red blood cell, and within the red blood cell, you have red granules.
Something like that. Top left picture.
Okay? This is specific for PV-Vax.
To just show them real quick. Shift the
Yeah.
granules. It's just.
It's a red blood cell?
Yeah, so you see the purple?
Yeah.
That's the infection, that's the Plasmodium infection. And then these are the granules, the purple granules. Okay?
Yeah.
Alright, back to your sheet.
Okay. Anyways, so the way I like to remember this is that I went to yeshiva day school. So basically, my rabbis always used to get mad at me. And like, doesn't Schuffner kind of sound like a rabbi's name, Rabbi Schuffner? Yeah. So the way I like to remember it is I'm drawing a rabbi with his hat, his mouth, his beard, you know, and he's always getting mad. So I'm gonna make him red. Okay? And then he's saying, you know, the rabbis are always going oy vey, you know, like when they get mad. So oy vey reminds you PV-Vax and P. ovale.
Ovale being the oi.
Thanks, guys.
Ovale being the oi, vey being the Vivax, you know?
We should.
Send that
Okay,
applicant-
next. So the rest, so this is just specific
Guys.
for PV-Vax and Ovale. I'm almost done. These are to diagnose all of these forms, okay? So the most important high-yield one, okay, is trophozoites in the red blood cell.
Trophozoid ring.
The trophozoite ring. So what you're going to have is, like a wedding ring, okay? You're going to have a ring inside the red blood cell. It really looks like that. Show them the picture.
You know a lot about it.
Yeah, exactly. I know a lot about rings.
Guys, these guys right here. Yeah, question?
What's this for? Which one?
Everything.
Everything.
Trophozoid rings for
This
everything.
is, sorry, this, what I'm going to draw right now is for everything. It's to diagnose everything, okay? This is the most high yield.
So guys, Schuffner granules is specific for Vivax Oval. These next simply we're gonna give you are gonna be for everything. And this is what a trophozoite ring looks like. You see how it looks? It looks exactly like you can draw it, like that.
It looks like a ring, a wedding ring.
Guys, the good news is, this is the good news. They're not gonna give you a picture of this, like a Schriftner granule or a trophozoite ring, and say, what is this? Usually they're gonna describe them in the question. They'll say, we found Schriftner granules, we found trophozoite rings, and maybe give you a picture also. Okay? So associate them.
Okay, next. They're also gonna say schizons. Okay?
You might see the schizons.
And merozoites. But again, these, they can show you a blood smear of this, but these, they're usually going to describe in the question stem. Okay?
One more thing with
one more
falciparum.
thing. So P. falciparum, you're going to have banana-shaped gametes. So this is specific. So these are for all of them. Okay? This is for P. vivax and ovale. And you're going to have banana-shaped gametes. They look like bananas. That's what they're called, banana-shaped gametes. This is for P. falciparum. Okay?
So guys, literally again, we don't know what they are, we don't know where they come from, but they like to use the word banana-shaped gametes. Associate that with falciparum. Okay? This
Okay.
is what one looks like. It kind of looks like a banana. Okay? Banana-shaped gametes, falciparum.
Okay, good.
And then all we need is treatment, and then we can get Nazi out of here.
Yeah. So treatment for all of these is usually chloroquine. Okay?
Can you erase the red line?
Yeah.
Sorry guys.
So I'm putting this in red. So you guys know the treatment usually is chloroquine. Okay? And then for P. vivax and ovale, you have to use chloroquine plus primaquine. And I'll explain why right now. Why do you have to use the extra drug? Because the interesting things about P. vivax and ovale. So remember guys, I explained to you this cycle. And then you have the trophozoite, which divides, which bursts, right? What happens with P. vivax and ovale, they actually create a latent stage, okay? Which doesn't burst, so they have some that burst, and some that stay latent. These are called hypnozoites. Okay? Hypnosis is like someone falling asleep. You know, someone's doing hypnosis on you and you fall asleep. So P. vivax and ovale has a hypnozoites. And you use that. You use primaquine to treat the hypnozoites, who are latent in the liver. Does everyone get that?
Guys, so this is how P. vivax and ovale will present sometimes in questions, okay? This is how the boards like to talk about it. Patient comes in, they give you the basic malaria-like symptoms like we talked about. We give them chloroquine, very nice, send them home. But then they come back with again, malaria. So they like to call this the relapsing infection, okay? That's like a word they like to use, relapsing infection, and then they can ask you what they like to use to prevent the relapse. How would you prevent the relapse? You use primaquine, okay? That's how the boards like to shape it.
Does everyone get that though? That you guys just have latent a stage in the P. vivax and ovale. Does everyone get that? Okay, and the way I remember, so hypnosis, right? You fall asleep, and they're prima donnas. So they're getting treated by primaquines because they don't want to move. They just want to chill. Okay? Everyone get that? Okay, nice. Okay, now the treatment that you can also use if these P. vivax, ovale, P. malaria, and P. falciparum are resistant, you can use mefloquine.
Guys, remember this association, mefloquine with resistant. Mefloquine with resistant, okay?
Okay?
You could get questions on it, you know, like in the IRAD, the CPR,
Usually the one that's
board.
going to be resistant, yo, I still have time, bro. Usually the one that's going to be resistant is P. falciparum. Okay? Because this is giving you false hope. It's going to be resistant, it's a bad dude. That's why I told you guys to remember bad dude. Okay? Now, also, P. falciparum actually has a unique,
What is mefloquine? Is that for P. falciparum or for P. malaria?
Okay, so it's in general it's used for everything, but it's usually used for resistant bugs, for resistant protozoa, who are resistant to treatment by chloroquine. So chloroquine is the one that you usually use. If that doesn't work, you try mefloquine. Okay, everyone get that? Now, P. falciparum is a bad dude because what it does actually, when it infects red blood cells, okay, it creates knobs on red blood cells. So it creates these knobs, and they're sticky knobs. So the red blood cells in the vessels, they stick to each other. And then they stick on the vessels. That can cause, so you have a decreased amount of blood flow to that organ, because the red blood cells are causing occlusion because they're sticking together, and that will cause ischemia. Okay, so you'll get ischemia usually in the brain, liver, and kidney.
So it'll present as like either they'll give you a description of renal failure. Like a patient comes in with malaria symptoms and they have renal failure, or they have pulmonary edema, or they have a stroke or something. Okay. So if you see malaria and then you start seeing symptoms with kidneys, lungs, brain, heart, think okay, maybe it's falciparum. Okay. You have to associate these things on the board. You got to take these clues, take these pieces, and put them together.
Again, guys, cyclic fevers is your key. That's a key word. Cyclic fevers. Okay, hemolytic anemia. The way you're going to see that is a decreased hemoglobin. Okay?
I'll describe that.
John will describe it. Guys, any questions, really? Because I know this is a lot of information. Yes.
Yes.
So malaria doesn't have a very major sign in terms of blood smear?
No. Except for 72 hours. Malaria is 72 hours.
Guys, an easy way to know these is just look at how often the fevers are occurring. If it's occurring every 48 hours, PV-vax. Malaria, usually you're going to have fevers every 72 hours. There's no specific blood smear for it. Okay? Yeah.
The mefloquine, will you give that in addition to primaquine in patients?
That's a good question. Primaquine is only used for the hypnozoites. Okay? Those are the latent stages. PV-vax has a latent stage called hypnozoites in the liver. Right. It's only used to treat those ones that are falling asleep. Remember, prima donna, because they're falling asleep, hypnozoites, hypnosis.
Right.
Okay? Mefloquine is used for resistance. If any of these bugs, and usually the one that's going to be resistant is P. falciparum is resistant, use mefloquine by itself. Okay, so I'll just write chloroquine plus primaquine. Okay?
Any more questions, guys? Move on.
So specific treatment for the first one, but for the second two, just generally.
Mefloquine, yes. So if it's chloroquine is general, but if it's resistant, which is usually going to happen in P. falciparum, use mefloquine.
Just look out for the word resistant, guys. Okay, not. Alright, guys. Any more questions? See us after, alright? Because we're kind of running a little behind. Alright. Are we good? Guys, that was long. Let's take a second and take a deep breath. You know, I understand we're all jet lagged. You know, we all came back from the United States, Canada, you know, some of us from downtown Tel Aviv. So we're all a little jet lagged, alright? I'm a little jet lagged too, okay? Guys, so now, let's take a little deep breath. And now we got a little John energy to infuse you a little bit, alright?
Oh, because it gives you false hope because you think, okay, I have malaria, it's irregular cycles, you know? It gives you false hope because it causes these bad symptoms. Okay, it can cause ischemia to your brain, so you have brain issues, it'll cause problems in your liver and your kidney. So it gives you false hope because you're like, okay, I got malaria, you know, I'll use chloroquine to treat it, but then it's also resistant. So now you need to use mefloquine, and it also causes bad symptoms. Everyone get it?
Alright guys, it's Babesia time. Let's take Plasmodium, put it on the side. This is what I recommend for all these parasites. Take them home tonight, talk them over with your friends. It's a new language, so you gotta get used to it. Use first aid, use Lippincott, and try to tease this stuff out. Anyway, Babesia time. Alright guys? What's nice about Babesia is it's like malaria, just like 1,000 times easier, okay? You already learned the hard part, the hard life cycle. Babesia, much easier. And you'll see why in 1 second. I'm using green, you know, to wake up your senses a little bit. Okay, so Babesia comes from the Ixodes tick. Okay? Ixodes tick. I-X-O-D-E-S tick. Okay? A person gets bitten by a tick, and Babesia gets transmitted that way. Alright? You also may have heard Ixodes tick transmitting something called Lyme disease. It does, okay? And you can actually get a co-infection with Lyme disease and Babesia. But like we've been saying all day, we'll talk about that in a minute. Alright, Babesia. How do we get it? So you have the tick, okay? Tick bites the human and puts the Babesia into the blood. And once again, we have a sporozoite. Looks like a sperm. Isn't this amazing? This is the exact same thing. But no, it's not. because it skips the liver stage. Oh my gosh, so much easier. It skips the liver stage and goes straight for the red blood cells. What I'm going to do is I'm actually going to draw the red blood cell bigger because I drew it too small. Okay, so the red blood cell is going to get bigger now. Okay, I know it's green, but it's a red blood cell, I promise. And the same thing, when the sporozoite goes in, what do we like to call it? Trophozoite. Trophozoite. Okay? And the trophozoite, just like in Plasmodium, turns into a ring. Everybody see this nice ring here? Seems easy enough, okay? This is the one thing that makes it seem like Babesia and not malaria. So you get the trophozoite rings, and you'll also get the trophozoite rings on, blood smear, just like malaria. But here, hold on. So now, everybody draw a second trophozoite ring next to your first trophozoite ring, okay? And then I almost want you to draw the same thing, but like, imagine this like, these two are just gonna divide and become two. So now you get this, okay? So it kind of looks like a cross. Okay, no it doesn't. I'll draw one that looks like a cross. But this is what happens. They kind of divide and they make themselves look like this. And you get this thing called the Maltese cross sign. Okay? And that's pathognomonic for Babesia. It kind of looks like this. You have your trophozoite rings, and you also get these
Maltese cross.
Maltese crosses. Now when it turns into the Maltese cross, when it divides, these Maltese crosses, or once it divides, it is again called the merozoite. Merozoite. Okay, when it becomes the Maltese
It's all
cross.
this. If you guys haven't noticed, it's all the same cycle. You have a bug that infects you. Then it releases a sporozoite. And it enters into the tissue, trophozoite. When it divides, it becomes a merozoite.
And the same thing. It causes the same thing. It converts the red blood cells and causes whatever. But the good news is, if any of you guys have Babesia right now, you might not even know it. Because most of the time, it's asymptomatic. Alright? Because this is a bug that the body can generally handle on its own. The spleen can generally handle this, alright? The spleen sees Babesia, no problem, knock it out of the park. But this is where people get problems. If someone is asplenic, okay? Asplenic means they don't have a spleen, okay? Now there are two situations the boards love to go after when it comes to not having a spleen. One is if someone has a splenectomy. And that means their spleen was removed. So the case would go as follows. A patient gets into a car accident, spleen ruptures, take out the spleen, okay? That's one situation. Another situation is sickle cell anemia. What happens in sickle cell anemia, you don't have to draw this is just so you can see. You don't have to draw this part. Imagine this being the spleen, okay? And imagine this being a blood cell, a red blood cell to the spleen, okay? In sickle cell anemia, the red blood cells go from this shape to this shape, okay? So if you have a bunch of this shape going into the spleen, it causes traffic jams, like that, okay? And these little crescent-shaped cells cause traffic jams, and eventually, over a few years, people with sickle cell anemia get something called autosplenectomy, where their spleen just infarcts, okay? All the blood vessels get gobbled up with red blood cells, and the whole thing infarcts. So people who are sickle cell anemia, or have had a splenectomy, could get symptoms from Babesia. What are the symptoms from Babesia? Oh, what do you know? They're malaria-like symptoms. That's why I love this one. Malaria-like symptoms. Okay? So you get the same things. Fever, hemolytic anemia, and chills. One quick thing, one quick physio reminder. Why do these people get chills? Because in order to get a fever, your body needs to increase the temperature. So how do you increase the temperature? You kind of shake like this, right? And that's what the chills are from. So they get a lot of chills because they keep getting the cyclic fevers. So what you'll see is in a case, you'll see that patient comes in with fever, anemia, and chills. And on blood smear, you see trophozoite rings and Maltese crosses. But wait, there's a little twist. Remember how we said that you can get Lyme disease from Ixodes tick? Is everybody okay right now? Before I go on to this? Okay. So, I talk really fast, so if you really miss something, it's okay, I won't get offended.
Did everyone understand the spleen? Why it loses blood supply?
Yeah. Okay. So, Ixodes tick, it doesn't pick and choose what to give people. It doesn't go, okay, I'm going to give you Lyme disease, I'm going to give you Babesia, I'm going to give you Lyme disease, I'm going to give you Babesia. If the tick has both Lyme disease and Babesia, and You'll learn about the organism that gives you Lyme disease later. I don't want to confuse you with too many microbe names. If you get a co-infection with this is how it presents. A patient comes in with the basic Lyme disease symptoms. They'll have the fevers, they'll have the target rash and stuff, okay? And now as a good doctor, you say, here you go, have some doxycycline and get out of my face, okay? And you send them home thinking that they're going to be healed. But then they come back. So they had Lyme disease, you thought they only had Lyme disease, you thought you cured them, but then they come back with malaria-like symptoms, you do a blood smear, you find trapezoid rings, Maltese crosses. What organism caused it? Babesia, there you go. And the good news is, that's it. Except now we do treatment. And it's easy, okay? Treatment. So, what comes before B in the alphabet? A. So we're going to do the A drugs, okay? A drugs. Alright? Azithromycin and atovaquone. I don't know what this is, but azithromycin sounds pretty familiar. And usually on the question set, they won't just give you atovaquone, they'll give you azithromycin and atovaquone. So if you know it's the A drug, you'll get the answer correct. And that's it for Babesia. Any questions?
Can you spell the bottom one?
Yeah, I can spell the bottom one. I think I can spell the bottom one. Yeah. Guys. Good? Atovaquone. Alright. Right here. Oh, it didn't show up. Oh, I typed it over there. I'm sorry. I'm sorry. I thought I had you there. I thought you know what's funny? And as I'm doing it, I'm feeling like I'm like cool and stuff. Right. I actually thought that was connected. Atovaquone. Vaquone. All right. Sorry about that, guys.
Okay. Any questions?
Yes.
So you only have symptoms of spleen, but you still get Lyme disease if you don't have
Yes, Lyme disease. If you have a spleen, you can get Lyme disease.
Lyme disease is created by bacteria.
Right. Lyme disease is a total different thing, but we don't want to give you the names. I can tell you the names.
You guys are gonna do it.
All right. So guys, next up. Everybody look at the next name. From what planet did this name come from? We don't know. Okay? Trichomonas Cruzii. No, Trypanosoma Cruzii. Wow. Nati's gonna make this clear. You're gonna be saying Trypanosoma Cruzii in your sleep after this one. Where's he?
Okay, guys, I know this is like a lot of information. So again, stop us if you have any questions. Trypanosoma cruzii causes something called Chagas disease. Okay? This is going to become really, really clear after I tell you guys a story about John. You guys are going to memorize this whole thing. Come on, who doesn't know John? His red shirt, like his crazy personality, drawing bladders on the board, No one got that, huh? Thanks, guys. Okay, so this is what happens. So what's gonna be the first step? A bug is gonna infect you, right? So you're gonna have a vector. Okay? So here's our bug, and here's its evil grin. Okay?
Yeah, this is evil.
This is an evil bug. Here's our bug. Kind of looks like a bee, but it's all good. Okay? This is called the Rudavid bug. Okay? In other words, it's also called the kissing bug.
Now you know why I got into the story about this.
Okay? And this is what happens. Here's a guy with his hands outstretched. Okay? This is a hand. Okay? And what happens is, this bug actually takes a dump on you. It doesn't bite you, it takes a dump on you. Okay? So it poops on you. You guys think I'm kidding, but this is true. True story. Okay? So what happens is, when it takes a poop on you, it actually, in the poop, in the feces, it has Trypanosoma cruzii, or Cruzis, inside the feces. So now, you guys are all, you have a poop on you, so you're going to scratch yourself, it's going to be itchy. And when you scratch yourself, you're going to actually cause the bugs to go in. Because when you scratch, you puncture yourself, so you allow the bugs, the Trypanosoma cruzii, to actually enter your body, enter your blood. Okay?
Nati. Let's say they don't want to get pooped on by this bug. Where shouldn't they go?
You shouldn't go to South America. So we'll get to that also. Okay? So this actually happened. Thank you, John. This actually happens in South America. But guys, we're going to make a story, and this is all going to become clear in a few seconds. Okay? So here's your Trypanosoma Cruzi. This is basically all you have to know about the pathophysiology. Okay? So your symptoms. First of all, you're going to have non-specific symptoms. All non-specific means is that they're not symptoms specific to this bug. Okay? Because you're always, when you're going to get infected by bacteria, by protozoa, you're going to get fevers. Your body wants to fight off the microbe. Okay? So you're going to get fevers, lymphadenopathy. Why would you get lymphadenopathy? Because your lymph nodes are actually what's fighting your infection. So they're going to enlarge because they're fighting an infection. Okay? But here's the specific symptoms. Okay? You're going to get something called the Romana sign. Now the Romana sign is actually periorbital swelling. So let's break down the word. Peri means what? Around. Orbit? Eye. So you're going to get swelling around your eyes. And this is going to be unilateral. Okay? So this is going to be your first sign of being infected with Trypanosoma cruzi. Okay? Then what's going to happen is you're going to get something, you're going to get, after, this is acute, and then you're going to get chronic infection. Okay? So your chronic symptoms, so chronic just means that you've been infected for a long time. Okay? So you're going to get a mega esophagus. What does mega sound like besides the supermarket? Big, right. Esophagus is your esophagus. You're going to get a megacolon. Okay? And you're going to get dilated cardiomyopathy. Okay? So again, easy way to remember this, and we'll make it into a story in a second, but when you chug something, your esophagus gets big, and like your stomach gets wide, like imagine drinking beer, your stomach gets heavy when you're chugging beer, Okay, chugging.
Chug.
Okay? So what happens here? We're not exactly sure they're not sure exactly what happens, but basically, like how it happens, they're not sure if the bug actually infects your nerves, or it causes inflammation and that destroys your nerves. Basically what happens is, the reason why you get a mega esophagus and a mega colon is because your nerves are infected. They get damaged. So you guys have taken, and we've taught you guys about esophagus and the colon, and they have muscle, they have contraction, right? And they have nerves that stimulate that contraction. You got peristalsis, okay? So imagine if you can't contract, you can't cause peristalsis. What happens is, you get food stuck in your esophagus, and you get food stuck in your stomach. Because you can't contract, so the food keeps building up, and then when you're trying to poop, it just keeps building up because you can't take it out. You can't poop it out, right? So you're going to get dysphagia.
That's a fancy word for can't swallow. But that's how they'll say it in the question set. They'll say, patient presents with dysphagia. So make sure you can associate dysphagia with not being able to swallow.
Okay? And you're going to get constipation. Again, these symptoms are because you can't contract your esophagus or your colon. Okay? And you're also going to get dilated cardiomyopathy. Again, because your heart nerves cannot stimulate your heart. Okay? So you're going to get a dilated, because it can't contract, you're going to get a dilated heart. So chugging, you get a dilation. Okay? Now,
can I just say one thing real quick?
Yeah.
So mega esophagus, okay? There's actually a disease name for mega esophagus, and this is really important because the boys love to go after the association, okay? This disease you'll find in GI. It's called achalasia, okay? Achalasia. All right, how will they describe achalasia? The patient has dysphagia, okay? So they do something called a barium swallow. They have a person swallow this barium fluid, and the barium fluid you can see on, on imaging, okay? And what you're looking at is the esophagus. So let's say this is the normal esophagus, okay? So this is what the normal esophagus would look like, just nice and straight. In a disease called achalasia, the bottom of the esophagus is kind of tapered like this, and then it kind of widens out, okay? And they give you something called a bird beak sign, because it looks like a bird's beak, okay? So you might sometimes they'll show you a picture of this. They'll show you a picture of an esophagus on barium swallow, and they'll show you this kind of picture. One of the causes of achalasia is Trypanosoma cruzii. Okay?
Guys, remember, because you can contract, so you're going to get food stuff, so you're going to get dilation in your esophagus, and also you can contract your sphincter between your esophagus and your stomach. Okay, so it stays, you can't stimulate it, so it stays contracted. Because the normal form is to be contracted. Okay. Okay, now treatment. Okay, you're going to have Trypanosoma. And benzonidazole.
Like Mercedes-Benz. Benzonidazole.
Okay, now how to remember this? It sounds like a bunch of random stuff. So, John actually...
So guys, this is the story to tie it all together, but any questions before we get into that?
What is that first word say?
Nefertamax. Yeah.
Why did you talk about achalasia?
Because
to not confuse the two?
No. Achalasia, achalasia is a disease of megaesophagus.
Oh.
Okay? The reason I talked about achalasia is because the question might just be in the form of achalasia. They might just describe a patient with dysphagia, and they might say something called barium swallow and bird beak sad, and you'll be like, huh? I don't want you to be like, huh? I want you to know what achalasia is and associate achalasia with Trypanosoma cruzii infections. Now, this story, I'll bring it all together to make it seem normal terms. One more question, Yoni.
Once the
Soma? Yeah?
gets the blood, what cell does it infect? Like, what happens next in the blood?
It goes to different organs.
Yeah, it just spreads out different organs.
So it goes to the blood and it can, right, your blood supply goes to different organs.
The cell type that it infects is not specific.
So there's no, like, RBC?
No.
No, so it goes into the esophagus, the cells of the esophagus, it actually hits the nerves of the esophagus, hits the nerves of the colon, hits the heart.
As a matter of fact, on blood smear, all you'll see is the actual you'll see the organism, but they actually call it Trypanosoma goat, right? Trypanosoma goat. That's what they call it. That's like the zoite formula we talked about, but that's the word they use. They might say we find Trypanosoma goats on blood smear. Okay? You'll see it in your first aid written like that. Guys, any more questions? Ask us after, okay? Because we actually are kind of done on time.
What's the name of the second treatment?
Oh, benzonidazole. Benzonidazole.
Can you just explain the kissing bug thing?
Okay, that's what we'll get to right now. Okay, good. So John, okay, so I call John like my second girlfriend because like I spend as much time with him as I spend with my fiance. So John, true story by the way. Anyways, so John, okay, he went on a date with this chick named Romana. Okay, so Romana kind of sounds like a South American name, right? Romana from South America. So he was excited because she's from Brazil. He got excited. He comes home. He does his little dance. You know his dance. Okay, so here's Romana. Okay, here's Romana, and he got excited. And let me tell you why he got excited. Because she actually gave him a kiss on the first date, which is crazy. Which is crazy. So she gave him a kiss on the first date. So Romana, for Romana's side, kiss for kissing bug, okay? And then, for some reason, girls in Israel, she's from Israel, but her name is Romana because her parents are from Brazil. So, okay? So here's John, happy John. Sorry, let me make his hair like this. Okay? And what happens is he's texting her, he's getting all excited, and she doesn't answer. Chicks in Israel do not answer. I know this from John. Ashley, don't worry. Okay? For some reason, girls in Israel do not answer. And so she was rude. Rudavid bug. Okay? Remember, kissing bug, if she gave him a kiss, Romana, Rudavid bug. Okay? So he came home, and what do guys do when they get upset and they get depressed? They drink. Okay? So he popped open some beers. Here's our beer. Kind of looks like coffee, but it's all good. And he started chugging. Okay, so you think of chugging as when you chug something and you chug beer, your esophagus gets dilated. You get a dilated colon, and like when you guys drink a lot of beer, your stomach kind of gets full. So just remember dilated colon. Okay, and then what happens is that he kind of gets woozy, right? Woozy. So remember Cruzi. Woozy.
Yeah, guys, you have to know this one's called Trypanosoma cruzii. Because there's another bug we're going to talk about next time called Trypanosoma brucei. So no cruzii. You get woozy, you get cruzy when you drink too much beer, okay? Because they like to put in the answer stand, brucei and cruzii. They'll try to confuse you, but they're not going to confuse you guys. We know.
Is there bruises associated with the other ones?
No.
That's just
okay, guys. One last thing.
Not yet. We're working on the mnemonic.
Here's our Woozy John, or Woozy, whatever you say. Okay, and then John, you guys didn't know, I wish I could pull up a picture, but he actually drove like a BMW when he was back in his heyday.
Blowing on my spot.
Okay, but we're gonna convert that into a Benz. So he got pissed at this chick. He said, you know what, I'm gonna get myself a Mercedes Benz. You know, what is it called? Hardtop convertible. Okay? He's like, impress the other chicks. So we're gonna draw a Mercedes Benz sign. And that's you remember, Benz are not itself.
Guys, the Benz didn't work, I'm still single. Anyway, guys, this is the thing, we just wanted to apologize. This went on a little longer than we thought. We have 2 more bugs. I'm doing them, I'm going to make them quick, alright? So let's just do it. Hold out for me. 2 more bugs, but the thing about these bugs is not a lot of detail to them, so it's good. Alright, we ready for some Leishmania donovani? Another one of those names, you're like, where did they come up with this? I don't know where they came up with this. Maybe somewhere in Africa they thought of it. Alright. Leishmania donovani. Can we get some slide action? Alright. Oh, this is what it looks like. How cute. That's the Trypanosoma. Ready to chug. Next. Leishmania donovani. Transmission. Okay, where you get it from? You get it from the sandfly. Okay? Guys, it sounds silly, but if you hear the word sandfly, what are you going to think? And if you see a description of Leishmania and they ask you what the bug is, what are you going to think? That's it. So it's like sandfly, alright? So what happens? The sandfly bites. Okay? The sandfly bites. And the Leishmania goes into the blood, okay? So when the Leishmania in the blood is in the blood, it'll get eaten by macrophages, okay? I'm going to draw all the steps and then go back to each step. It gets eaten by the macrophages, but it has a virulence factor, which I don't know what it is, that it's able to survive in the macrophages, doesn't die in the macrophages, and then it goes on to infect the visceral organs, okay? Mainly the spleen, the liver, okay? And while it's in the blood, obviously, as we know, it can cause fever, okay? So let's talk about some of the other names of this disease, okay? So Leishmania donovani causes visceral leishmaniasis, okay? So just like Plasmodium causes malaria, Leishmania donovani causes visceral leishmaniasis, okay? And how do you remember that? We're going to draw a square around visceral, and we're going to draw a square around visceral organs. You see how that matches up? Okay? So now, it's hard enough that we have this, and it's hard enough that we have this. But you know what? They decided to give it more names, okay? They also like to call this disease the Kala Azar. Right? Right? I know. Anyway, I looked up the translation for Kala Azar. No, I'm just kidding. First they gave it to me. It's known as the black fever. Okay, why the black fever? Well, first of all, let's draw a triangle around fever, and draw a triangle around this fever, and see the black fever tells you that this thing causes fever. Okay, but why black? Because so this is the thing about Leishmania. It doesn't really have an animal host, not vector, reservoir. It doesn't have an animal reservoir, so it only bounces from human to human. Okay, very nice. Sandfly bites human. Leishmania is living in the human, but how does Leishmania get to the next human? What Leishmania does is after it's done replicating and causing all the damage here, it causes hyper or hypo, but pigmented spots. Okay. So I'll explain that in a second, but the hyperpigmented spots, hyperpigment looks black, that's why it's called the black fever, for the hyperpigmented spots. So these spots, hyperpigmented or hypopigmented, act as a landing strip for other sandflies to come and bite the human again. Okay? Very simple. Hey guys, it's John. Just wanted to clarify what I meant by Leishmania doesn't have a reservoir. So to compare, another bug, Babesia, usually lives and reproduces in the white-footed mouse. Then the tick will bite the white-footed mouse, and then the tick will bite the human and give the human Babesia. In Leishmania, there's no animal for it to reproduce in. So it's literally sandflies biting one human, and then biting another human, and then biting another human. There's no mouse or deer in between for Leishmania to bite. Back to the lecture. Let's go into symptoms. Okay, symptoms. It causes a spiking fever. It causes hepatosplenomegaly, which obviously we know why. Spiking fevers instead of cyclical fevers, so the fevers get really high. Hepatosplenomegaly, and something called pancytopenia. Let me explain pancytopenia. Okay? So we know what these two mean, now we're going to talk about pancytopenia. So pan means all, cyto means cell, penia means without cells. So that means we have a decrease in red blood cells, a decrease in platelets, and a decrease in white blood cells, okay? So now there's two ways this can show up, okay? One way is on labs. So how will they show it on labs? They have to show red blood cells as hematocrit and hemoglobin. So what they'll do is they'll show you values on a question stem, and then they'll show parentheses what normal is, or you have to look up what normal is. If these are lowered, you have decreased red blood cells, and that's known as anemia. Okay? Same thing with platelets. Good thing for platelets, it's on the labs, it says platelets. And if that's low, you get a thrombocytopenia. Thrombo is anemia. Platelets cause blood clots. Another word for blood clots is thrombosis, okay? And decreased white blood cells, same thing. On labs, they show white blood cells are lowered, and that's called a neutropenia. Like neutrophil, but neutropenia. Okay? But sometimes they don't give you labs. And they're not just going to tell you, patient comes in with anemia, thrombocytopenia, neutropenia, and got bit by a sandfly. It's not that easy. Okay? They have code words for these things. Because the boards are trying to trick you. But they can trick Technion if they want. They're not going to trick Sadler. Okay? Hey, I meant no disrespect to any Technion students out there. But if you watch this video, then you won't have to worry about getting tricked. Anemia, another word for anemia. If you see someone that comes in with fatigue, you have to think they have anemia. That's a general symptom, fatigue, but that could point to anemia. So you see a patient comes in with fatigue, think they could have anemia. Why fatigue? Because if you don't have enough red blood cells to bring oxygen to your body, you get tired. Thrombocytopenia, they have bleeding, okay? Or something called purpura, P-U-R-P-U-R-A. Purpura, okay? Purpura is just bleeding into the skin. So they don't have platelets to clog up like blood clot. They don't have platelets to clog up like if blood vessel breaks. So you get purpura. And neutropenia does increase infection. So what they might say is patient comes in with fatigue, purpura, and recurring infections. They just got back from like Africa or something, and they have hepatosplenomegaly. What did they get bit by?
Sandfly.
So if I give you those things, can you diagnose Leishmania? No, you can't diagnose Leishmania. You got to do a blood smear. You can never diagnose these on symptoms. You always got to do a blood smear. On blood smear, and this is very important. This is very important. All right, for a blood smear, you're going to see macrophages. Okay, so macrophages containing a mastigotes. Okay? Just like trophozoite was the infection form for malaria, a mastigote is the infective form of Leishmania, and that's what you're going to see. Why is this so important? This is so important because this is the only protozoa we talk about that is involved with a macrophage. So if you're on the test and you see macrophages and you think it's a parasite, you can just not look at anything else, you know it's Leishmania. That's how pathognomonic a mastigotes and macrophages is for Leishmania. Okay? You've got to cement that into your head.
So guys, just quickly, the way you can tell it's a macrophage is that you see the nucleus, this is the nucleus, and these are the mastigotes. The purple little dots are the mastigotes, and that's the nucleus. So that's how you know you're in a macrophage. Okay? You see a big purple ball.
Hold questions for a second. And treatment, real quick, I'm going to put it on this board so I can write it big. You have amphotericin B. I'm just going to write it AMB. That was one of the drugs that Dr. Ostroff told you before, or I'll tell you next time. And sodium stibogluconate. Okay? And that's it. Random drugs, but you have to associate them. By Thursday, you have to be able to associate each drug with each protozoa. Okay? And we're on the last one. I mean, I saw him in his chair when he got this question. He was like getting giddy. He was so excited because once you see
Guys, it was actually John who did that. He just.
Once you see the symptoms for this, you're like, boom, Trichomonas vaginalis. It's that simple. Okay, Trichomonas vaginalis. Let's spell it loud. Let's spell it proud. All right, Trichomonas vaginalis. Okay? Very simple. What's the bug? Other human beings. Sexually transmitted. Alright? That's the only way to get it. No bug carries it. Okay? And there's no specific area. Anybody can get it anywhere. Alright? So, sexually transmitted. These are the symptoms. Usually a young woman being a teenager or early 30s, someone sexually active comes in with burning, itching, yellow, green discharge. I mean, this is nasty stuff. Yellow, green discharge, foul smelling. Okay? This is not somewhere you want to be. Alright? Foul smelling, and it has a specific strawberry cervix. Alright? Strawberry cervix. Why strawberry cervix? Because the bug actually causes inflammation to the tissue in the vagina, and you get this red cervix. Okay? Pretty simple. This is usually how the boards like to ask it. This is how they asked it for us. 30-year-old woman comes in, burning, itching. We saw green. Once we saw greenish discharge, it's the only thing with green discharge. We knew, but we read the rest anyway, just for fun. Okay? So, greenish discharge, and then it says, again, let's to throw in their sexual history sometimes, and that's even a bigger tip-off. It says, this one said she has one partner, but doesn't always use condoms. Sometimes she says that she has unprotected sex with multiple partners. That's what they like to say. They used to like to tell you that they're sexually promiscuous. Okay? And then they give you the rest of the symptoms. Okay? Seems pretty easy, right? Except the boys have better ideas, because there's another bug that has very similar symptoms, but not the same. Okay? It's a bacteria called Gardnerella vaginalis. Now this chart's in your first aid, but you can write it down so you don't get confused. Alright? You also get the burning. You also get the itching. And you get a fishy, and it's smelling odor. Now I'm not kidding about the fishy. It's actually called the KOH whiff test. You don't have to know that now. But there's actually a whiff test to tell that it's fishy odor. Okay? No strawberry cervix, and you get a grayish discharge. Okay? This bug is not sexually transmitted. This bug comes up spontaneously in women who have too much sex. I didn't think that was possible, but it looks like it is. Okay? Now sometimes the boards will try to confuse you, okay? They won't tell you what color the discharge is, and they'll give you burning, itching, and discharge, okay? How do you tell the difference? No. Naturally, a wet mouth, okay? A wet mouth is what you use. Sorry, oh no, my bad guys. No, this is wet mouth. That's wrong. Now it's gone. That's wrong. No, it's wet mouth, not blood smear. Wet mouth. That's key. Wet mouth. So they'll tell you on wet mouth, you find motile organisms. Okay, motile organisms. FYI, this is a pearl. If you see motile organisms in any question, anywhere, you know automatically you're dealing with a protozoa. alphabet. It's not bacteria, it's not virus, it's not fungus, because that's how they describe protozoa. Motile organism, okay? Gardnerella, you'll have something called clue cells. And you'll learn all about these things in bacteria, okay? Let's do treatment, and then let's get the hell out of here, all right? Treatment. Treatment is with metronidazole. You have to know this drug, like all the other ones for Thursday. Metronidazole, so study up. But we have a mnemonic for you, okay? What does metro sound like? No, metro sounds like metro. Metronidazole sounds like metro, okay? So you want to get out of the way, right? If a metro is coming, you want to get out of the way. So the GET is what stands for stuff, okay? Now you can write this down now if you want. We're going to do this again next time because the G and the E in the mnemonic are for next time, but we'll write them anyway. G is for Giardia, E is for Entamoeba, and T is for Trichomonas, okay? So no, get out of the way of Trichomonas. You don't want to be in the way of a vagina like this, okay? And that's it. That's it for parasites.
Guys, really quick. Guys, study our sheets.
Yes.
This is what you're going to get quizzed on. Memorize it. It's not hard. Just memorize
Guys,
it.
your IRAD's going to be on this, okay? What we told you today is the IRAD is
What is that
something
thing you were
else.
saying?
Huh?
What?
Giardia, Entamoeba, Trichomonas. Alright guys, and that's it. Go away.
Well done.